Hello learners, welcome to this session. Today's topic of discussion is environmental quality and human health. I must tell you that this particular topic is related to the course MEV 018, that is Environmental Health and Ecotoxicology. This course is a part of MSc Environmental Science program, MA Environmental Studies program, and also postgraduate diploma in waste management. So, in this session, we will learn about the relationship between environmental quality and human health. What is environmental quality? What determines it? What are the different factors responsible for maintaining good quality environment and how human health is affected? Further, in this session, you will also learn about what is human health. What does it comprise of? And in the changing circumstances of today, that is environmental pollution, climate change, so many types of problems occurring in the environment, does human health get affected? If yes, then how can we prevent ourselves? In the wake up of environmental degradation and deterioration, it is important to see that how our health is influenced by the changing environmental conditions. Learners, first of all, let us understand what do we mean by environmental quality. See, we have environmental terms, various. For example, we talk about environmental settings, environmental systems, environmental conditions, and all these are the properties of the environment. And when we say about the properties, it means that different components of the environment, the systems of the environment like air, water, soil, etc. If you look into the definition of environmental quality, it is a set of properties and characteristics of the environment. They may be generalized or location specific, that is local, as they impinge on human beings and other organisms. Or in other words, if we simplify this definition, we may say that it is a measure of the condition of an environment relative to the requirements of one or more species, any human need or purpose. This is not as simple as it appears to be, specifically when we try to relate it with health. See, environmental quality refers to properties. What is air quality? What is wind speed? What are the physico-chemical characteristics of the water bodies? What is the soil type? What is soil texture? And so on and so forth. We cannot say, looking into just the parameters or the different standards which have been set up, that whether environmental quality is good or bad. Why? Because in an ecosystem where human beings are also living along with the other species, it has to be a species specific environmental quality. Why we are saying is that in the definition itself we have seen that it refers to the set of properties or conditions that affect the survival of the human beings or the other species. For example, there are several organisms which thrive in very hot climate. There are certain species which live in the colder climate. So, if you compare the parameters, if you compare the data of different locations, you will find that it varies from one place to another. So, when we relate it with environment, with the human health, we must know that what determines the health of an individual and what changes in the properties of the environment are going to influence us. Take the simple example of the quality of the air. Even if the concentration of pollutants, whether it is particulate matter, whether it is dioxins, whether it is certain harmful gases, the concentration of these gases into the atmosphere will have varying impacts on different group of the populations. So therefore, we have to specifically understand the environmental quality in relation to a particular species, an organism, or the other segments of the population. So if this environmental quality term is clear to you, if you understand it, let us now understand what is human health. Because the properties have been influenced by various natural and the man-made factors. We are very well aware of this fact that human beings have an influence on the various types of environmental factors which are present today. But then what is human health? When do we call ourselves healthy? When do we say that environmental quality leads to unhealthy individuals? According to World Health Organizations, health has been determined and health has been clearly defined that it is not merely the absence of diseases. It is a state of complete physical, mental and social well-being, and not merely the absence of diseases. So if you do not have any disease, it doesn't mean that you are healthy. To be a healthy person, you have to be physically, mentally and socially well-being. But in the recent years, the concept, the ability to live a socially and economically productive life has also been added to the concept of human health. So, a good human health or a person or an individual with a good human health is not only physically, mentally and socially at its well-being, but is also leading a life which is socially and economically productive. Having a disease is one thing, but living a healthy life with a proper state of balance of physical, mental and emotional attitude is a different thing. So now when you look into the various aspects of environment, you will find that yes, there are issues with different types of the population, with different age group of the population, with different location specific individuals who are living at a certain place. So learners, this must be very clear to you that what is health, because in this course you will be studying about various factors which are affecting the health of the people. This session we are talking about environmental related factors, but then you will also be learning about the various types of the diseases, the ways by which you can prevent the diseases. So one thing must be very, very clear in your conceptual wise, that what is human health and what is health particularly. So there are different dimensions of the health, and one by one we try to understand that what are the various dimensions. The physical dimension of your health. Physically you are fit, physically you are healthy when you have proper food, when you are not malnourished, when you are not undernourished, when you don't have any disease, means you have vaccinations of all the diseases, when you are able to take rest, means you don't have any ailment, means all your vitals, all your bodily factors are in the desired range. That is your physical wellness, that physically a child or a person is leading a life which is as per the age requirements, as per the standards which have been fixed. So if your body weight is fine, if your hemoglobin is fine and all those factors. And generally what happens is that when we discuss health, we are basically meaning only the physical wellness of an individual. But environment goes beyond that. There are various examples, various case studies where we have seen and we have got the records that a person is fine physically, no issue, no disease, but then also you are facing a lot of issues because of maybe noise coming from the various sources, or because you are living in a congested area, because there is a lot of unhealthy practices going on in the surroundings. So that affects your other dimensions apart from the physical ones. Then you have the mental dimensions. If you are stress free, if you are able to concentrate, if you are able to sleep well, if you are able to take decisions, if you are able to if you are having a life which is balanced, then that is the mental dimension of your health. Moving on to environment and health. It is very important that before we dive into what are the factors and what is happening to human health because of environment factors, let us understand, and does environment have an effect on human health? See, there are various examples. In air pollution, we find a lot of figures, statistics which say that air pollution is leading to so many premature deaths occurring, or it is leading to various air pollution related respiratory disorders happening in the human beings. So environment and human health are directly related. However, this is also true that at various occasions the environmental factors do not translate into the health problems immediately. There, or in other words, we can say that there may be acute effects, but the chronic effects may appear after a long period of time. And this is basically the reason where we are not able to establish the linkages between environment and human health, because the effects of pollutants, toxicants, hazardous substances, unhealthy living conditions appear after a very long time. And therefore, cause-effect relationship is very, very difficult to imagine. However, environment and human health are intrinsically related. Yes, you cannot have your healthy mind and a healthy body if you are living in a bad environment, if you are living in a polluted environment. Good environment is an indication of good health. If you are living in clean environment, green environment, if you have access to fresh water, if your surroundings are free from toxicants or contaminants of any type, it indicates your good health. If you are eating good food, if you are breathing fresh air, if you are drinking clean and pure water without any impurities, it indicates good health. And pollution of various kinds, whether it is air, water, soil, plastic, whatsoever we may name, and the other anthropogenic disturbances. By anthropogenic disturbances, we mean haphazard development, unplanned urbanization, climate change, and related issues. They lead to various diseases. Those diseases may appear to be indirect, but in most of the cases this has been proven that it is causing maybe your longevity is reduced, your productivity is reduced, you may have complaints of sleep disorders, you may have cardiovascular issues, and at several occasions we are not able to understand that it is because of the state of the environment in which we are living. So, we have just gone through it, that what are the physical determinants of health. Physically, we have seen what gives us good health, physical good health. And that will come through, yes, through good food and through breathing fresh air and water and all that. Chemical determinant is, see, we say that what we are eating is today now just the poison. The pesticides are there in the foods. Toxicants are there, and even if not outdoors, indoors also we are exposed to various types of carcinogens, various types of chemical pollutants. That is the chemical dimension, determinant of health, and the biological. We have seen the cases where there are a lot of allergens or molds or pollens and pollutants which are biological in nature. They are also there, and we have seen that what happens during pandemics and all, it is all because of the invasion of the bacteria, virus which are there in the air, in the surroundings, and they enter into our bodies and leads to various types of diseases. What has happened in the last few years is that we have become more exposed to all the types of the determinants. We are facing heat strokes, heat stress, cold stress in the extreme winters, which is because of the environmental disturbances. When we say climate change is occurring, and when we say that there are natural disasters occurring because of climate change, rainfall occurring during non-monsoon days, or it is occurring for a long period of time, or it leads to spells, it leads to vector-borne diseases. The climate is rising, tropical diseases are on the rise. We have chemicals in our food, in air, in various types of things which we are exposed to. we are ingesting chemicals from all the sources, and we have also the biological impurities surrounding us. So in this state of mind, what we are observing is that we need shield from various physical, chemical and the biological invaders which we are having nowadays. So we talk about air pollution. We know that particulate matter, respiratory suspended particulate matter, different types of carcinogens, harmful gases, ozone, nitrous oxide, sulfur dioxide. The list is very long, and this affects our respiratory systems, like having there are, you must have seen this thing that sometimes it's like the environment or the clean air is not there, you start sneezing, there is an irritation in the eyes, and you may have mild disorders. But if it gets prolonged over a period of time, and the people who are working in such areas, and that is why we pay so much of attention nowadays towards the occupational diseases. The people who are exposed to these chemicals, or the people who are exposed to air pollution or various types of pollutants over a long period of their lives, they get cancers. They get various types of issues which are really critical in nature. The elderly are more susceptible. The children are more susceptible. The people who have low immunity are more vulnerable. So this is a direct correlation, and we have around 7 million deaths, it is said, worldwide are occurring prematurely because of air pollution. That is a serious issue. Then natural disasters. In the time of the natural disasters, there is a physical as well as the psychological stresses. Whether it is landslides, earthquake, floods, we have seen, water gets accumulated. There is insurge of vector-borne diseases happening like dengue, chikungunya, Zika fever. These are very common nowadays occurring. Climate change, yes, it is one of the major reasons, because all the types of disorders happening because of variation in the temperatures, the extremes of the weathers that we are facing nowadays, prolonged summers, extreme winters, they are causing diseases in the human beings, diseases due to microbes in the environment, lack of access to healthcare facilities. So these are some of the factors which affect our health, and these are the related to the environment, but also we have several socio-economic and demographic determinants. The income level of a person determines his or her good health. If you do not have access to facilities, if you do not have access to primary healthcare centers, if you do not have medical facilities, if you are not able to pay, and apart from it, you can have the air purifier at your home, you can have water purifiers, somebody may not. And this is an excellent example of environmental injustice. When pollutants are released into the atmosphere, there is a certain section of the communities who are exposed to it. They have no solution to it. And vulnerable communities, marginalized communities, those who are living near the landfill sites, those who are poor, they are more exposed. Women are more exposed, whether it is indoor air pollution or whether it is outdoor air pollution. Then gender, yes, as I said, females are more affected because of air pollution related cases, because of, as a whole, environmental quality, if it gets degraded, it is the women who are affected the most. Several studies have proved it. Employment, where you are working, and your education. If you are educated, we know that what is bad for our health. How can we prevent ourselves? We have various options available. The government does a lot of programs to educate the masses about what to do and what not to do to prevent happening of the diseases. But then if you're aware, if you're educated, then automatically. So these are the socio-economic determinants of your good health, which are also in some way or the other related to the environment. Now, these are some of the statistics which alarms us. See, we are trying to relate quality of the environment and human health. But if you focus specifically on the population, demography, and the state of the affairs of the human population, you will find that most of the population growth today is occurring in the low and the middle income countries. Most of the by 2050 the water stressed regions are going to double the people who are living. So, and food security is also an issue. Prices are rising globally, extreme weathers are happening. In these circumstances, if you pay attention, you will find that there's a close linkages between the nature of the population, the growth of the population, and the occurrence of the various types of diseases. So if you look at the projections for 2035 or 2050, you will see that what is predicted as there are certain pockets where the population will be very high. You will be having skewed sex ratio in various parts of the globe. You will find that because of climate change and because of increase in the sea level rise, there are several islands which will be disappearing. You will find that agriculture is affected. How we are going to feed our population, that is an issue. So when you think about health, health policies, health programs, all these type of things, it is very important for us to consider the projections for future which are coming and the environmental predictions which are made. There will be water scarcity. How we are going to look into the health of the people, how we are going to educate them. Then because of climate change, agriculture will be at it's very bad. There will be rise in the vector-borne diseases because of climate change, and tropical diseases will be occurring. How we are going to provide the medical facilities to our masses. So these are some issues which really need our consideration, and therefore a World Health Organization came up with the term environmental burden of diseases. Now we have to quantify, we have to see that how much of the disease load is because of the environment. So therefore environmental burden of disease, it's a concept which was introduced by World Health Organization to quantify the impact of environmental risk factors on population health in a comprehensive and comparable way, and it represents the proportion of ill health attributed to exposure to environmental factors. It is a way by which you can relate that how much of the disease, how much percentage of the diseases which are occurring today and in the future which are going to occur can be attributed because of the change in the environmental conditions, because of pollution, because of sea level rise, because of climate change, because of waste generation, because of plastic pollution, because of what. So that gives you an idea, and therefore it is also a term which is given as quality adjusted life years. It is a term which gives you the quality and the quantity of life lived. It is used in economic evaluation to assess the value of medical interventions. If you live for 60 years, if you calculate in this way that a person living for 60 years, how many days per year you are sick, that gives us an idea about the productive days. So if you are sick, if you are not working, that comes under the unproductive days. And also how much we have to spend on the medicines and other health related interventions. By this term, quality adjusted life years, we are in a position to assess that what is the quality and quantity of life lived. So per year, if you are 15 days, 20 days, if you are falling sick, or a month on an average you are falling sick because of various diseases, and you calculate for 60 years, you will find how much of the life you have wasted. And it is all because of the fact that you are sick, and that sickness is attributed because of the maybe drinking contaminated water or living in impure air conditions and whatnot. Likewise, we have disability adjusted life year, which includes, as quality adjusted life year was speaking more in terms of quality and quantity of your life lived. But disability adjusted life year tells you about how much of your days of your life you have wasted, which have gone like that, or which you have lived more if the environmental conditions would have been proper. So we can read this as a measure of the overall disease burden expressed at number of years lost due to ill health, disability or early death. It was developed in 1990s as a way of comparing the overall health and life expectancies of different countries. So if you compare the data from different countries, you will get a striking example of those countries where disability adjusted life years are more, where people are not able to survive, they are not able to live their complete life because of the factors that they were exposed to chemicals, or they had a stroke, or they suffered because of some natural disaster occurring at their place, whatso would be the reason, or there were absence of the health interventions or facilities, whatever it is. But this is very true that if the environmental quality we are not able to maintain, if you are not able to provide good environmental conditions, if you are not able to maintain, then these number of years lost due to various types of environmental problems, it is going to rise in the future. And therefore, this is very true in the present context that we have been able to increase the lifespan of the people. Maybe the life expectancy at the time of independence was 45 years, but today it has 78 years or 79 years. But we have come very down in terms of your health span. So why we are having so many types of diseases, so many types of problems, so many types of health related disorders occurring at a very young age, and that speaks volumes about the fact that even we may be living longer, but at a very early age we are exposed to various types of diseases just because of various anthropogenic factors, because of the presence of contaminants and the various types of pollutants which are being released into the environment because of various natural as well as man-made factors. Need not to forget that this is not the scenario of the rural, urban or the indoor, outdoor, even if you are indoors. Because if you're not going out also, at your home also, in the rural as well as in the urban areas, a person is exposed to various types of chemicals, various types of toxicants and so on and so forth. So learners, it was a pleasure interacting with you, and in this session we have learnt about the various factors which affect the environment, and the environmental quality affected influences our health in various dimensions. Thank you so much.